I'm Dr. Yeko, Timothy Yeko. I'm a board-certified reproductive endocrinologist, and I work with a specialty group called the Reproductive Medicine Group in Tampa. As a reproductive endocrinologist, you're mainly taking care of infertility patients, and about 15% of all couples have that problem. Everyone's looking for answers when you have difficult problems. There's a myth out there in patients who have infertility, and that is, if they don't have pain, or if they have never had an experience of pelvic inflammation, that they can't have any problems wrong with their reproductive system. But we all know that there are women who have had serious pelvic infections that went relatively unnoticed, and yet they now have the consequence of all the scar tissue and infertility as a result. And there's also patients with very severe endometriosis, but their pain threshold is so high that they don't know they have a problem. They have gynecological problems like ovarian cysts. They may have blocked tubes or scar tissue that's affecting their fertility. And certainly tumors of the uterus, fibroid uterus, is a very common presentation along with their complaint of infertility. So don't just assume if you're not getting pregnant that some of those conditions aren't present. And if you go see your gynecologist or a reproductive endocrinologist, they do some very simple tests to give you reassurance that those things that you might not have been suspecting, you can rule them out or find them. A positive message that I would give to patients with infertility is that the vast majority of them do not need surgery, and that small segment that does need surgery, you're seeing them being offered more and more minimally invasive procedures. Minimally invasive procedures have become the trend, and it's great to see these patients be able to go home the very same day, be fully recovered in 10 to 14 days. If infertility was your complaint, and yes, besides that you had fibroids maybe as the cause of that infertility, I would see your gynecologist. They'll understand whether you're somebody who would be a good candidate for robotic surgery. The compelling fact today is the trend in minimally invasive surgery, that when you actually do need to have surgery, 25 years ago, I would say probably 90% of the procedures I do now would have been through a large incision. Now, 90% of them are done minimalistically, minimally invasive surgery. I would choose St. Joseph's Hospital to have my procedure because I think it is the premier women's hospital of Tampa. A great hospital to be at, and every one of my patients say they feel like it's a family atmosphere when they're here, and that's not the same everywhere.